Yeah. Okay, welcome to everyone tonight. I'm just going to wait a minute or two so that everyone gets a chance to join. But thank you for joining us on this kind of cold winter's evening. Appreciate it. Yes, I was just going to wait a few more minutes so to give everyone a chance to join, but thank you for joining us this evening. Okay, sure. I'll kick it off. So obviously tonight we're going to be talking about looking after your mental health during fertility treatment, which will be led by fertility counsellor Helga Bean. But first I'll just talk just a little bit about Sims IVF. So Sims IVF, we have three main clinics. So we've one in Swords where Helga is usually based. We've one in Clonskee in South Dublin, we've one in Cork, and then we also have three satellite clinics in Dundalk, Carlow and Limerick. So what these satellite clinics do is that they kind of facilitate bloods and scans during your cycle. So it saves you multiple trips to the main clinics. We're also part of Virtus Health, which is a global provider of fertility treatment. So we have a fantastic network of support available to us. So just a little bit about tonight. If you have any questions at all, just pop them into the Q&A box there down at the bottom. And myself and Helga will go through them at the end. But yeah, I suppose I'll hand it over to Helga.
Okay, thank you so much. It's great to be here and thanks everybody for coming. I'm just going to share my screen now. Now, so as Aoife said, I'm going to be talking this evening just about mental health and fertility treatment and how it can affect. So you might recognize this kind of long, windy road, lots of edges and corners to it, windy, and you don't know where the end of the road is going to be. So I think that's a good visual of what it can feel like on fertility. So first of all, I'm just going to go through the effects of fertility on mental health, and then I'm going to go on to talking about like coping skills and how you can look after yourself. So we will talk about grief and loss, like the bereavement, communication and low self-esteem, okay, which low self-esteem, I'm going to bring in like feelings of guilt and shame and how you can feel less of a person and lack of control and things like that. So again, just another visual of the emotional roller coaster that you can feel when you're going on the treatment. So the stages of grief and loss of any kind of bereavement is usually, as you might know, shock, denial, anger, guilt, depression, acceptance. Acceptance to me means that you learn to live with and you move forward. And also like the effects that it can have on your body. So like when we all think of grief and loss, we think about losing a loved one, losing a relative, whatever, like that, you know, somebody that you absolutely, you knew, you bury, you've got somebody to bury or to cremate, whatever. But this kind of grief and loss can start a lot before that, a lot before you start fertility treatment. It can start off with when you try and have a baby, you know, you're at home trying for a baby, or you think about, you know, you're trying from month to month and then you get a period at the end of a month. So that can be a loss. It's like a loss of the potential of what it could have been. It's like a loss of the hopes and the dreams. So what I'm saying really is that that kind of loss is just as important, and with the effects as well of any kind of loss of a loved one. And this is what some relatives and people around you don't really understand, especially around miscarriage, because you've nothing to show for it at the end. And people don't realize that the feelings of the grief and loss goes deeper than any kind of bereavement. So I think that's really, really important to mention. Also the impact on the body. We forget sometimes that our body is working very hard to make this work. Like the body, like if, for instance, now we're talking about fertility, we're talking about your fertility, your organs, your ovaries, your womb, and how that has a job to do. So its job is to produce and have a baby, okay, and to have your eggs and from your ovaries and all that. But can you imagine going to work every day and not being able to achieve what you're supposed to do in your day? Well, I believe that the body can feel that too. So your womb is there working hard, trying to produce, trying to do its job, and it's finding it hard. So it's just I think sometimes we get angry with our bodies when we're going through fertility, and we blame our bodies and stuff like that. But I'd love to just put a different look on it for you, is to say that maybe your body is working really hard to try and make this work, and it's finding it hard. So how that must impact on the body. Also, we're going to talk about like the communication with family and friends. Like, who can you tell that you're going through this? Do you want to tell anybody? Is there certain family members that you wouldn't tell because they'll tell everybody, not at fault of their own, but that's just the way they are? Or is you going to just talk to nobody and tell nobody and keep it to yourself? So then who do you have? Is it good to have the counsellor on site that can look after you, or to offload, that kind of thing? And if you're in a couple setting, you know that you have each other as well, and how that works for you. So it's about that communication and how that can be difficult sometimes. Excuse me. Work as well, the workplace, you know, the pressures of work. You know, you need time off for going for an appointment and going for egg collection. You know, you don't know when your egg collection is going to be until nearly you're on top of that day. So it's about, you know, is there somebody in work you can tell? The pressures of that. Is there nobody you can tell? So it's that kind of, that can come up. So just to recognize that that's what does happen. Your own self-esteem, feeling the guilt and the shame, feeling less of a person, the lack of control, like you're feeling that you're not in control of this. Usually in life, when we do something, we achieve it. Like if we have an exam or a job interview or something we go for, we work so hard and we know absolutely everything, so we go in with confidence, and then more times out of 10 we get the job. But with this kind of treatment, with fertility treatment in general, it doesn't always work like that. So it can feel very out of control. And also isolation. Isolation can mean, like, you know, people knowing you're going through this, so they say, oh, we won't invite them to this event, or we won't, like a christening or a baby shower or something like that, because no, we won't bother, because it might upset them. But really, there could be isolating you out of something that you would like to make the choice yourself, even if you didn't go, but you'd like to make the choice. Also, as well, if you're not up to anything and you're keeping yourselves to yourselves and not getting involved in the outside world kind of thing, that can feel very isolating, even though it can help you, and you can feel alone in that, you know. So just talking about going into now to the self-care. So we're going to talk more about the communications and coping skills, and then like my role of a fertility counsellor, or any fertility counsellor that you would be going to. So, so the communication as a couple or an individual, like what are your needs? Like what is your needs from each other? Or if you're doing it on your own, of people around you. Sometimes when you're going on fertility treatment with somebody, when you're on the road with somebody as a partner, it can feel kind of lonely as well. People can think differently about fertility treatment and the emotional impact. So you could have one partner that says, no, I'm going to say nothing because I don't want to upset my partner. I'm going to just go to work and I'm going to not say anything, or I'll just stay quiet. And then you've got the other person that needs to talk, wants to cry, wants to talk about it all the time, and feels lonely because they think the other person doesn't care. So it's about trying to meet in the middle. So how can we meet in the middle? How can we sort of help each other out? And sometimes you need support around that. Sometimes it'd be hard to see the wood for the trees about what the needs are. So it could be talking to somebody like me that would, and I would do that a lot with couples, especially, is to sort of work out what their needs are, and then saying, okay, well, how do we bring that into here? You're both here. How do we bring it to here? And it can work very easily that way. Excuse me. With family and friends, again, what I said, is there certain people that you can talk about your fertility journey to? Is there a certain person that you know will keep it to themselves? They won't go to somebody else and tell anybody else, that you feel safe with that person. Also, I think it's good to know that you will call on people for support if you need it, that you won't, if you don't want people texting you all the time or ringing you all the time, that you just set up some kind of nice little agreement with them, saying, look, I have really bad days, I have really good days. So if I have a really bad day, I'll text you or I'll contact you. That's okay, if that's what you want. So you just look at what your needs are and what you will need from everybody around you, you know. And again, it could be telling nobody this. There's no set agenda for this. There's no right or wrong way. It's your way, and that's all that matters. So the same with the workplace. You know, do you have a boss that you can talk to, you know, and say, look, I'm going through this, I'm going to need time off, I'm going to have to come and go, is that okay, or how can we work this out? Or it could be a colleague, you know, somebody that has your back. But not all people have that in work. So if you can't tell anybody, and it's just no way, it's not safe for you to do that, and they'll think, okay, she's going to have a baby and then she's going to leave and things like that, you know. So it's about thinking about, okay, what do I need? Do I need to take time off? Sit down with the clinic and work out, okay, like around about dates and things like that. And of course, with me as well, I can work on that with anybody as well. Just about what your needs are. It's less pressure as you can from work, because it can be a lot of pressure if it's not the right environment for you. Some people can change roles in order, or work from home a lot more, which we all can do now, which is great at times. So it's looking at that, okay. Also looking at your clinic, you know, like what is your needs from the clinic? You know, are you worried about needles? Okay, so if you're worried about needles, getting needles, you sit down with the nurses. I can talk for the same, like everybody is so supportive in there. So, you know, the nurses are great. You can sit in and they can go through it with you, and then you talk, okay, how do we make this as easy as possible, because you don't like the needles? Okay, first of all, we lie you down in the bed and we'll do this, that and the other. So it could be around knowing more information about the sedation or anything like that. Like they will be there and they will, you know, so you look at what your needs are. Do you need more information? Do you need things explained a lot more to you? If English is not your first language, how do we work that out for you? So your clinic should be on hand to do that for you. Okay, so and then it's looking at yourself. You know, how do you look after yourself in your own personal space? You know what I mean? And my first thing would be giving yourself a lot of empathy if you can. So this leads on to really what I said there about empathy is like coping skills. So we're bringing it to yourself as your individual self, okay? So how can you help yourself? I'm going to name these off now. Mindfulness, breathing. It's surprising when people are surprised when I say breathe, because sometimes we breathe from up here instead of taking deep breaths in. And it's amazing. I do it myself all the time, just by taking deep breaths in and out, and it does an overcalm on the body. Exercise, you know, I know through treatment, it's hard to do any kind of exercise. You nearly have to give up everything in order to be present to the fertility treatment, you know. So it's about, like, you know, if you usually do lots of exercise, maybe you get in a gentle walk in the evening, like look and see what your needs are that day. Sleeping, you know, listen to the body, especially. Do I need extra sleep? Do I need to have a lie on today? Can I have a lie on today? I'll come home from work and have a rest before I have dinner or something like that. So it's looking at all these things that you need. Also, as I was saying there, like asking the question, what do I need today? So when you get up in the morning, it's kind of thinking like, okay, what are my needs? How am I feeling? Am I feeling a bit down today? Okay, how can I look after myself and that, well, look, I don't need to stay and work all day. I'll come home a bit early, or when I come home, I'll just go for a walk, or I will do whatever. So it's looking at like preempting of what your needs are for the day. And just by naming that and being aware of it, it'll work for you. It'll happen. Also, again, I'm talking about the effects on the body. Like the body does remember when traumatic things happens to it. So it's being aware of that and what is your body needs. Again, when it's tired, rest it. You know, like just looking at it in general. You know, like I have a headache. Okay, I need to do something. I need to put a pack in my head. I need to, whatever it is, but just be very aware of how your body is. Excuse me. And then one of the big things I think is like, what am I in control of? Because it's a very out of control, as we mentioned earlier on, as I mentioned. So what are you in control of when it comes to the cycle? And a lot of you might say nothing, but there is something that you're in control of yourself. So the medical stuff. So you think of the whole big picture of fertility. Think about all the treatment, all the medical stuff and everything. You're not an expert in that. You're not supposed to be an expert in that. So you pass that all on to the doctors, the embryologists, and the nurses. They know what they're doing. They're doing it long enough to know. So they really get it and they know what they're doing. So you pass all that on to them. So then what you're left with yourself and what your own needs are. So in order, you ask yourself, okay, how can I make the best of this for myself to get through this treatment? How can I make the best of this to make this work? You know, so that's like eating, drinking, just looking at your overall being. You know, some people like to go for acupuncture, some like a little bit of a massage, some just like to go to bed early, some just, as I say, the walk, extra sleep, whatever it is. It's okay. Again, there's no right or wrong way of this. It's your way, and that's the best way. Small steps, take one day at a time, especially when you're on the treatment, when you can. Now, this is the ideal. It always doesn't work like that, or not always, or, you know, it's about dragging yourself back into your mind. You know, you're just say, okay, you've started treatment, you've had your first scan. So it's like, okay, I'm in today, the scan went well, we'll see what tomorrow brings. So when tomorrow comes, okay, you see what tomorrow brings, and then first, you know, but we race on and we think about, oh God, what if this doesn't work? Or what, you know, I'm dreading this bit. You just bring yourself back as best you can. Again, and get the supports you need around you if it just gets too much. You know, like I would hate to think that you're sitting in this overwhelming feeling and really upset and not knowing what to do. Well, then you go and get the supports that you need, you know, from the counsellor. If there's questions or any worries you have, I say that all the time to the patients, you know, any worries or concerns, you ring straight away. Don't sit on them. Ring up, get them asked, and then get on with the rest of your day. And then that's it. So it's about those little things. They're all really, they seem like small things, but they're actually big things. Again, then your supports. What are your supports around you with the people that you have around you, or if it's acupuncture or anything like that? Self-empathy. This, I love empathy, of course, but it's really, really, if you can empathize with yourself, I have there, shame can't survive. So I think shame and guilt are a big part of fertility treatment, because we feel guilty, we feel that we're not doing a job, we're letting our partner down, we're, you know, whatever it is. So, but shame comes with that. I think shame and guilt are quite the same in ways. So I think that if you empathize with yourself and look after yourself and just even pat yourself on the back in your body and know that I'm doing everything possible here, I'm really working hard at this. And if you do that, well, then shame can't survive, because, you know, there's nothing to be ashamed of. You've done nothing wrong, you know, and people could say that. I could say that to you as I was blue in the face, but it's about owning it yourself. Like, you've done nothing wrong. This is nobody's fault that you're in this position. So it's just being reminded of that. And all of these things I'm saying is like, you know, it doesn't happen overnight. You can't flick a switch, but it's just been reminding yourself, even if you had little cards or little affirmations on it, you know what I mean? I'm going to do well today. My goal today is that kind of thing. And as you say it and as you keep doing it, your mind actually starts believing it, and then it'll just automatically happen, you know. So this, as I was saying, the mindful, your mind is just totally bogged down with everything compared to mindfulness. So mindfulness is like, you know, doing something like, you know, if you're in the moment of not feeling great and your mind is exploding, you try and think of like the senses, 5 things that I can see, 4 things that I can smell, 3 things that I can hear, 2 things that I can taste, that kind of thing. And if you just concentrate that in the moment, that's what you're dealing with. And that's really what mindfulness is. It's concentrating on what you want to concentrate in that moment, and everything else just falls a bit. It could be only for a couple of seconds, but still that's a couple of seconds. So the role of the specialist fertility counsellor, so somebody like me, of course, is somebody who can understand and empathize, somebody to listen, somebody that does not give judgment at all, absolutely no judgment at all, can normalize your feelings. And what that means is that you could have, you're having all these feelings, and feelings that can come up is like, oh, just if I was talking about myself, like, where's the fun Helga gone? She used to be there. She was there years ago. And since I started this, she's gone and I'll never get her back. Or, I'm just feeling so bad myself. I just feel I can't do this anymore, that kind of thing. So they are all normal feelings to have. And that's what my job would be, is to say, that's okay to feel like that. That's very normal of what you're going through. But let's look at it and see how we can get the fun bit back. And I would say things like, remember if you're with a partner, when you got together first. Remember how you used to do this, all the fun you had when getting married and things like that. Go back to other experiences. And it's the same with an individual, like remember the happy times. Remember all the crack you used to have when you went out with your friends, or you did this, that, and the other. You know what I mean? So it's finding those things again and remembering they are still there. They're just fogged over with all this fertility. But that's okay to know that, and to understand that that's normal with all this. It's like the bereavement and the loss. It's all normal with all this kind of treatment, and it's okay. So also is to help you work out techniques and coping skills. Again, like it's looking at your life and how you normally cope with things. So how can we adapt them into here, in the here and now? How can we adapt stuff? Is there anything else new we can introduce? That kind of thing. Decision making as well, that can be a hard one for some couples or individuals. It can be like, if you have to make decisions of, should I go again? Should I just leave it? I just don't know if I can take it anymore. So that's a really good area that I can help it, or any fertility counsellor can help in that we sit down and we look at it all, we lay it all out on the table and we explore it all, we look and see, okay, this is where you're at, this is where you are. Well, what about this and what about that? And it's just going through it all, and then whatever comes of that. It doesn't mean that always the answer is an easy, happy answer, but it just means that you know where you start. And at least then, because when you don't know what you're doing, or where you get stuck where you are at, and you can't like grieve and mourn the potential of what it could have been if you're finishing up. So it's about putting a bit of closure to it and then moving forward as best you can, really. Also helping with relationship difficulties. It can put an awful lot of pressure on couples. So it's about like it's clearing all the fog of all the arguments and all the misrepresentatives, or you said this and you said that. So it's what my job would be, to sort of get rid of all that fog and then go back to see, okay, where did all this begin, and that kind of thing, and just looking at it and getting used to see it as it is, and then just working on those things. So again, it's the same thing. It's giving a safe space for you, or both, if you're in a couple, to talk, to explore anything and everything of what we've talked about. Exactly what I'm saying there, to explore and not float. Could be just coming in and saying, oh my God, I just had an awful day, and just like going through all of the bad and upsetting feelings you have, and then you say, okay, I feel lighter now, thanks a million, bye, that kind of way. So it can be just like that too, or answering a question. So this is what I've done up a little graph here, with the fertility treatment in the middle. Okay, so your focus is on that. It does take over your life to a certain extent, with everything else. So it's having everything around that fertility treatment, your life around that, in the best possible place in order for you to be present to the fertility treatment. Okay, so it's having family and friends, the people around that you want and the people you don't want not around, social events, the workplace, the less pressure as you can. And there's lots of other things as well that, you know, I'm sure there's different things for everybody. So it's about having it all in the right place in order for you to be present to the fertility treatment, you know, as best you can. This is an ideal. It doesn't always work like that. And we all know that that's what happens. It doesn't always work out, but it's just being aware of it again and knowing. And then when you're aware of it, that I can't take because such and such, or I can because this is coming up, then you know, you need support around that. And then you get the support from wherever you need it. So I'm just finishing on the word self-compassion. Self-compassion, hold on, I just sorry, hold on, because I really love this. Oh, I've lost it, sorry. Self-compassion to me is really, really important. It's about being kind to yourself and looking after yourself. So it's empathizing with yourself. And, you know, when you suffer or when you fail, that's okay. So it's looking after yourself and that, and not being self-critical of yourself. So it's just being kind to yourself. Okay, so that's it. Thank you very much. Thank you.
Thank you so much, Olga. So yeah, we're going to go over to the Q&As now. So this lady, she's done 4 rounds of IVF and had 2 miscarriages last year. Sorry to hear that. She feels like she hasn't dealt with the loss, like she said, and like you mentioned. And is there any tips to help?
Well, exactly what I'm saying, you know, like any kind of bereavement is recognizing it for what it is first, and looking at like what your needs are. And it could be, you know, if you're finding it hard to move on from it, it could be talking to somebody like me, do you know what I mean, in order to work on it and to explore it and to see what it's about. But it's very normal to feel like you do. And I'm just wondering how long it is since, you know, it was last year, wasn't it? Isn't that what you said? It was last year.
Last year, yeah, 2 miscarriages last year, yeah.
So the fact, you know, it could be hard to deal with when you're going on to more treatment and everything like that. So it could be hard to get the time to just sit with it and to deal to work on it on yourself. Do you know what I mean? Because you're going in from treatment to treatment. Also, as well, you can do little rituals or something like that, like with your losses. Like, is there something that you'd like to do in memory of that miscarriage? You know, there might be something that you'd like to together. Are you sitting together enough? Have you talked about it enough together if you're in a couple? You know, it's those kind of things. So it's looking at the whole big picture. But that's certainly something, if she wanted me to talk to her, I'd be happy to do that. If there was anything I could help her with that, because it's hard.
Yeah, thank you, Olga. So this lady's just asking for any advice to stop stressing about being anxious.
Yes, that's one of my big sayings. It can be stressful, try not to be stressed. So again, it's putting all your looking at how you normally would deal with your stress, and looking at what's worked for you before, you know. And it's if you could write a prescription for self-care, it'd be great, because we would all go by it then. So it's about like looking at what your needs are. You know, do you need time off work? Do you need, you know, is there something in particular that's stressing you out? That's, you know, it's a little bit of hanging over you or putting pressure on you. You know, is it you putting pressure on yourself in order that this has to work and that's it? You know, so it's just looking at that and looking at, you know, like what has worked for you before? What can you put in place? You know what I mean, for yourself. You know, it could be doing some kind of alternative stuff as well. So it can be very, you know, it's so true. It can be so stressful trying not to be stressed. So it's letting it out. It's like, okay, I'm feeling stressed over this, so I'm just going to let it out. And it's okay. Like, just because you're feeling stressed doesn't mean it's not going to work for you. Do you know what I mean? There is a thing, you know, oh, if you don't relax and if you don't do this and if, you know, it won't work. But it can be, as I say, as you're saying, it can be too stressful, trying not to be stressed. So just let it go, feel the stress, feel like, okay, I'm having a bad day today. What I'm going to do is that I'm going to just come off work early and I'm going to go here, or I'm going to have a nice dinner. I'm going to go for a walk on the way home. from work or whatever it is, and then that'll help. So stress is part of everyday life. You know what I mean? There's just extra stress on this because of the whole nature of the beast, as they say, of the fertility. And that's quite normal. So it's about just, thinking about that. It's not going to work because you're stressed out. But if it goes on and you're really, really feeling that it's impinging on everything, then you go and get the support from where you need it. I hope that answers it a bit.
Yeah, there's just another one kind of similar enough, how to ease sadness and anxiety about time passing while trying to conceive no children, to accept that it isn't happening yet, and to be at peace with time passing by.
Yeah, because we worry about time. We worry about the, like, oh gosh, like I'm this age and it needs to happen now. I think it's very common to feel like that, and it's just about your self-care and not worrying, as much as as you can, just to take it as it comes. Do you know what I mean? What was the last bit of that question, actually? Can you just repeat that again?
They're just saying to accept that having children hasn't happened yet, and to be at peace with the time passing by. And so they just want to know how to ease that kind of sadness, but also to be accepting, with time passing by, I suppose.
Yeah. And I think it's a hard thing to do, is to accept, when you're working so hard at trying, it is really hard. But it's knowing that you're doing everything medically out there. Like the fertility treatment now is on top of the game as such, so we're up to date scientifically as well of the treatment. So knowing that you're absolutely doing everything possible to make this work, the doctors, everybody is, and for yourself, that you're putting everything in place for yourself in order, like as we've talked about, your self-care. And that's it. That's all you can do, and it's okay, like, to take, if you're thinking of like, I can't start next month, or I can't start the month after, you're talking about 1 or 2 periods. You know what I mean? Like, that's not going to make a difference with your care, with going ahead, or your, delay your, of it not working kind of thing, if you know what I mean. So it's about, it is a hard thing to accept. But if you have everything in place and are so confident as you can be, that you're doing everything possible, so you're putting actions into place, and that's it, really. That's all you can do. But it's looking at all alternatives as well to help you with that, what your needs are, what can help you through that.
So there's 2 questions come in about dealing with the 2-week wait, which we all know can be quite a difficult one. And should they be hopeful or neutral, because it can feel disappointing if it doesn't go through that particular cycle?
Yeah. Well, first of all, it's very hard to be hopeful, and yet it's very hard to be prepared for disappointment as well. So it's about, you can't prepare for it no matter what, so it's just sitting with it and taking it day by day. Like, you can say to yourself, okay, look, it mightn't work and everything, but it doesn't affect how you're going to feel, the disappointment you would feel if it's not going to work, unfortunately. So there's no real preparation that you can do for that. So it's about, like, taking it day by day and looking at your needs in that day, thinking, like, like, I'm still doing everything, I'm resting, I'm doing everything possible. I find, talking to people, like, after the transfer, it gets quite exciting. People are like, oh God, this is great, like, we've got our transfer. And as you get to the end of the 2 weeks, it gets scarier, and it gets, oh my God, I'm going to see now, has this worked, or what's going to be the outcome? So that can be the hardest bit. So there's no way about it. It is the hardest part of the whole cycle. So it's about, like, as I say, just putting things in place for yourself in order to make it as easy as possible. And so you might be hopeful one day, you might feel totally the opposite the next day. So it's just going with it, and it's okay to feel all those. So there's nothing specifically that you can do in order to prepare for the news at the end, unfortunately, really, So it's just putting everything in place. It's all self-care and getting the support from where you need it, But it's difficult.
Yeah. Another kind of query is around having trouble staying asleep at night and finding it very hard to get back to sleep because their mind is racing.
Yeah,
And tips for that, I
yeah,
suppose. Yeah.
yeah. It's looking at again like what works for you. It could be a meditation, it could be just music, it could be anything, you know what I mean? It's just and something that you can fall asleep. Like if you listen to a meditation tape or something like that, now it doesn't have to be like this deep meditation thing. Some people are not into meditation at all, but it's nothing that you have to, something that you don't have to actually act on. You know, you can lie there with your earphones in and just listen. It could be just to music of nature, like birds and the wind and the rain. Like I know myself, I love to listen to the rain. I just like it. So it's about that. That would work for me, maybe, So it's just looking at that and falling asleep with that, with them in your ears. Your brain is still taking in all that. So it's doing something like that, it's when your mind is racing again, it's the mindfulness techniques, or it could be that you need to offload. So it could be a matter of sitting down with somebody and just letting it all out of all the feelings and everything that happens, that you're feeling about the whole situation. And then so it's looking at, like what would help really as best you can, and getting the support from where you need it as well. Yeah,
Yeah.
not easy.
Perfect. No, not at all.
Mm,
Um, I think these are most of the questions now I think we've answered so far. I'll give it a minute or two if anyone wants to kind of pop in a few more questions. But if you feel like you don't want to ask something on a public platform like this, that's fine. You can email us on communication@sims.ie, and I'll send an email around. Well, I'll send the recording around, and also just kind of the email address as well if anyone wants to kind of ask anything further, or if there's anything that they felt they just weren't comfortable asking here.
yeah.
That
And I could talk
we're
to
happy.
anybody if they want. If there's anybody
Mm,
that would like to contact me, if there's any questions, or, through you or whatever in particular,
yeah.
if there's anything that they want to ask and didn't want to ask here, like I'd be very happy to answer them. If there's
Okay.
anything that they would like to ask, if they find it's too personal or anything like that, it's no problem at all.
Okay. Thanks, Helga. Yeah. Um, and then I suppose that this just I think this one question came through there. So any thoughts on how to deal with setback sadness when a cycle didn't go through, or maybe was cancelled?
Yeah, absolutely. It's the same kind of feeling of what I've talked, the loss of the potential,
Mm,
the loss and the setback. Again, it's just putting things in place for yourself, of what your needs will be and how can you look after yourself, what would help, you know
mm,
and recognizing that it is like a bereavement, the same kind of feeling. The loss is the same as any other bereavement. So it's working it from there. And when you
mhm,
recognize that and know it, you know how to look after yourself and move to it, and give yourself the time, give yourself permission that, don't sort of say, oh, I shouldn't be feeling like this. You know what I mean? It just didn't work. Do you know what I mean? Or, this kind of thing. It's like as if you don't deserve to feel like that. But you
mm,
do deserve, if whatever way you feel is the way you feel. And that's just it. Again, there's no agenda. There's no rule for anybody in particular. It's your way, and that's the only way that matters. So it's dealing with that, and then what your needs are,
mm.
regarding that. So, and that's
Yeah.
that's it. So it's just recognizing it for what it is, and then letting it run its course. And then if you
Mm,
feel that it's going on too long, or you feel that it's just hard to take, then you get the supports from wherever you need it around you, or from the
mm,
clinic or whatever. And it's okay, like you're never judged. I know I said no judgment, but there really isn't. Like if you're in a clinic and you want to avail of the supports of the counsellor, like we're delighted, because we know that you're getting we want to meet your needs as best we can. It's just as important as the medical needs, you know like, so if you need emotional support as well, like we want to make sure that you get that. So there's no judgment on thinking that, oh God, this, she can't go on or she can't cope. There's none of that at all. 100% none of that. So it's about just being available. And that's why they have somebody like me in the clinic in the Sims, is because they know that these emotional impact is there. They know that people need the support, and it's 100% okay to have it, you know.
Yeah.
So it's just to remember that too,
Yeah. So it's an interesting one. So how to deal with friends who want to find out everything, but you don't want to talk.
Yes, absolutely. Yeah, so you're always going to get the one person or a couple of people that'll say, and how are you? And looking at the stomach to see, is she pregnant? Is she not? Or what's the story? So it's really having something prepared when you're going to meet these people. It's like going to events, it's like having something prepared and having your answer ready, very nice and kind, but you're not going to get into that or whatever, whatever's comfortable and what to say without telling me anything. And if they say, like, are you having a baby, or are you going for fertility treatment, or how's the fertility treatment going, if you've already told them, and saying, look, it's fine, it's all going grand, you know what I mean? I do look at, thanks very much, but if when I want to talk about it, I'll definitely let you know. Do you know what I mean? But I just really, we don't want to talk about it here now. But look, I'll let you know if I want to talk about it. You can say something without it being sounding rude, so it's putting that in place. Or really, if you can avoid telling anybody that would be like that, because they're not any kind of, they can't help you with your, by having them there to talk to, because they don't want to talk about it all the time, or they sort of break your little boundary of wanting to keep it separate. So really it's telling people, as I was saying before, when you want somebody to tell somebody, just look at, have your sort of thing in place. Like, I'll only talk about it when I want to talk about it, if that's okay, but I really need to talk to you now about it and how I'm feeling or whatever. And then do it at that. So you have your little rules, to put a better word, or your little boundaries in place with that person beforehand. And if they break that, well, then you just say, or it could be a matter of just, especially if you're going through a really hard time around, if the cycle didn't work or anything, it's just not having contact. Or they text and say, look, I'll be in touch with you, or something like that, So, but yeah, so it's that kind of thing. So it's thinking about it beforehand. But if it's too late that you've already told them anything, it's just like cutting it nicely, but saying, look, I really don't want to talk about it now, but look, I've come to you, even though you probably won't, but just that you will come to them if you really want to talk about it. But you have some really nice days that you don't want to talk about it, so whichever works for you and what way it helps you to say it. Yeah.
No, that's some really good tips there. And then there's another one here. Just any thoughts on how to be okay with taking a break from it all?
Yes. And that's a really important one, because it's hard to do, because you want to keep going, but your body, your emotional impact is kind of telling you, I need a break. I can't do it for now. I need to take time. And I think it's really acceptable to take time, even if you're at the age where you feel that you can't, because you need to know that you're giving it everything. You're giving it your 100%. So if you're not feeling you're giving it your 100%, well, then you need to look at that. It could be taking a month or two off in order just to take the break. It could be 6 months, like I've talked to couples that are saying, oh, I just need a break, and they're going to take a break now till after Christmas, and they're going to take this break in order to feel a little bit of freedom. Now, it's not like a big freedom, but it's a freedom to know, I don't have to do that. I can have my drink now with a Christmas, or I can do this, that, and the other. They're all nice little nuggets of freedom in order to get back some kind of normality. So then when they come back in January, they'll be all feeling, oh yes, now I'm ready to start again. I'm feeling in a better place. So it's important to feel in a better place physically and emotionally, that you're ready. So I think there's nothing wrong with taking a break. So if you can look at it like that, like if you're talking about 2 or 3 months, you're talking about 2 periods, that's it. Do you know what I mean? If you look at it like that it's not like a big, huge break, like of age or anything like that, And again, I would definitely talk to the consultant, your doctor, about it as well in the clinic, to see like how they feel about it. So get everybody's input of the experts as such. So talk to the doctor and say, look, I think I need to take time off. What would you think is the best, that it doesn't put me at risk of being older, affecting my eggs or whatever, sperm. So, and then take that information as well, and then work it out. But I think it's a hard thing to take a break when you really want it and you're going for it, and you know, and you're trying so hard. But it's okay to take a break, because it means that you're more ready and in a better place to start again when you're ready. Really, it's a good question.
Yeah. And then just the last question here, which do you have to be a Sims patient to avail of the counselling? And no, there is fertility counselling options out there. You probably know a little bit more than I would. Helga.
You don't. Yeah, there's IFCA is Irish Fertility Counsellors Association. They have all the specialist counsellors that specialize in fertility. It's so important, and it's a really not a good question. You need to get somebody that really specializes in it, because some counsellors out there might see one or two people and have done a couple of sessions with fertility, but they're not specialists. So you need to go to somebody so we were well protected in our IFCA. You can look up the website. It's IFCA, Irish Fertility Counsellors Association, and we're all specialists there. So we all have we're all long time in the field. So it's a specialist area. That's why we're called specialists in the area, because it's a very specialist area. And we all work privately as well. Most of us, we do both. So it's absolutely no problem, you know, the kind of way. So please do it that way if you're doing it. Don't do it through just anybody. Just go through the IFCA website, you know.
Yeah. No, I can send on a link to that website when I send an email around tomorrow.
Yeah.
And then there's just more queries kind of around cancer support, part of IVF package or additional costs. It can depend, isn't it? If you're going through donor treatment, you have to undergo mandatory counselling, isn't it? Like that is part of the package. But it would be it would be
just for going through for the counselling end of things. It's just really the counsellor just wants to go through everything with you, all the ins and outs, the emotional impact and everything. Do you know what I mean? Because there's things you don't realize, and then you think, God, I never thought of that. Do you know what I mean? So it's just to inform you more of everything that's involved in it. You know what I mean? Like you've got all the medical stuff and everything, and the nurses, and they're all great. So it's about the emotional bit and what can come up, and you know, like telling the child, not telling the child, you know, those kind of things. We only do identifiable now, as you know, Aoife. So it's about like the effects on that and the long term of, you know, on a child and all that, you know. So there's lots involved, the legalities of it, you know, like, and all that, you know. So there's lots of little bits that we would like to, you know, that's why they say that to see a counsellor is to go through all that. That's what it is, you know. You're just makes you more informed. That's it.
Yeah, so I can send on details of costing and things like that. Again in the email out tomorrow. And I think we've come to the end of most of the questions there. So like I said, if there is something that you felt wasn't answered here today, or you feel more comfortable being kind of maybe answered offline, that's no problem at all. Like I said, I'll be sending an email around tomorrow, and please do reach out if you have any queries. That's why we wanted to have this session. We kind of have it, you know, a couple of times a year, and I just think it's very important for people to kind of understand, like, you know, fertility treatment can be quite difficult on you mentally. So I think it's important to kind of recognize that, and it's great to have Helga here kind of going through these tips, because again, they're just so important. And so I hope everyone found this helpful this evening, and thank you for attending to this evening, and thank you, Helga, for all your amazing tips. Really appreciate it. And like I said, I'll send on all the information about IFCA, about and the recording tonight as well, and then kind of contact details if you want to reach out to us further. But thank you for this evening, and I hope you have a lovely evening.
Yeah, thanks a million. Thank you, everybody. Thanks, Aoife. Bye.